Hello, I am Dr. Samya Mittal. I'm a neurologist. I work in Noida and Greater Noida. And today I'll be talking a little bit about migraine. Now, migraine is a very common disease, very common illness in India. It usually affects ladies more than males. And the reason of the headaches are not very common, not very well known. The features of the headache are temporal headache. Now, temporal headache is this area, and it is more like a pulse, like a it comes and goes. It goes like dub 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 dub. So with every pulse, you feel a little bit of pain. The second thing is people always, not always, but sometimes they develop vomiting or a sensation of vomiting. They might feel what we call as photophobia, that whenever they are in the sunlight or in bright light, that headache will increase. It can also trigger the headache. Similarly, phonophobia. Phonophobia is a phenomenon when loud sounds can increase the headache or it can trigger the headache. Now, there are many triggers for these headaches, like strong smells, sunlight, bright lights, loud sounds, strong smells, lack of sleep. These are some very common features. There are a lot of food items and cold drinks which can trigger the headache. Now, these headaches, these triggers have to be individualized. Every person has a different trigger. So, when we are talking about the management, the treatment of the headache, the most important part of the headache management is controlling the triggers, avoiding the triggers. Because if you can avoid the triggers, the chance of the headache developing in the first place becomes less. So it is very crucial to identify your own trigger and take the precaution to avoid these triggers. Second thing, then there are two ways the headache proceeds. One, what we call as an acute headache, and one what is called as a chronic headache. Now, acute headache is the episode of the headache. These headaches usually last for a few hours to a few days. So one episode of the headache, maybe 8 hours, maybe one day, maybe 2 to 3 days. That is one episode. That is an acute headache. And recurrent headaches makes this what we call as a chronic headache. Now, when there is a chronic headache, we have a separate set of medicines. When we have an acute headache, we have a different set of medicines. So for acute headache, there are many medicines which have been available, like paracetamol, acetyl salicylic acid. Now, these are the medicines which have been in traditional use for a long time, and these have been found to have a very good response initially. But after a period of time, as this progresses, as the headache progresses, sometimes these medicines do not give that good a benefit. Now we have got very good medicines. There are a large number of medicines which are available now. For example, we have got triptans. One of the examples of triptans is rizatriptan. This medicine usually comes in a dose of 5 to 10 mg, and it is quite effective. It can help get a very quick relief, and the side effect profile is not very common in most of the patients. So this is a very nice medicine which has come in now. The other medicines are also present, and these are also good medicines which can be used. For example, naledixic acid, which is often used. So these are other medicines. So these are the newer medicines which are available. Talking about chronic headaches, a large number of medicines have been available, like anti-epileptics, which have been used in lower doses to control the headaches, and like topiramate, gabapentin, pregabalin. So these are the medicines which have been used to control the headaches. And now we have got newer injections, newer medicines which are coming up, which are called as Cgrp receptor antagonists. Now these are the newer molecules which are coming in, and they are also supposed to be very effective in a very low dose. Like maybe a once in a month injection gives you a good relief for the entire month. So these are the newer medicines which are coming in. So if you have a headache and it's very common, you can always meet your doctor for a good relief of migraine. It is possible to get a very good relief. Thank you.